So as a 15-year-old girl is presented to the emergency department complaining of lower abdominal pain. Her mother is with her. A nurse tells you that the mother wants to be present in the consultation. Which of the following is the most appropriate response? A, ask the nurse if the patient, the 15-year-old, consents to her mother being present. B, ask the patient yourself if she consents to her mother being present. C, see the patient with her mother, but ask her mother to leave if it becomes clear that confidential information needs to be shared. D, say to the mother that you may be able to speak with her after seeing the patient. E, speak to the mother first and ask for her account of the problem. What do you think?
Option B, you ask the patient yourself if she consents to her mother being present.
Okay, so option B being given. Any other suggestions?
B.
B again.
Yes, B.
B again. Okay, now this is a relatively complex question. I'm going to just try and unpack it a bit. So first of all, here's a 15-year-old coming with lower abdominal pain. What if you get a question like this? What do you think the college are suggesting that's relevant in a question like this?
Pregnancy.
Possibly pregnancy.
Yeah, maybe C.
Let's just discuss this a little bit. So pregnancy, what else could be wrong with this girl?
Sexually transmitted illnesses or infections.
Yeah.
PID.
Be more specific. So
PID.
what problem?
PID.
PID.
She might have pelvic inflammatory disease. Okay. So if you get a story like that, just think, okay, this might be pelvic inflammatory disease. Okay. Mother wants to be present. Okay, what's the issue there? Of course, I mean, fairly obvious, but it's confidentiality, isn't it? That's the issue.
Confidentiality.
Yeah. Now then, let's get into this whole issue of Gillick competence. I'm sure you've heard of this. So in general, is a 15-year-old who makes in the general situation, who makes decisions about the healthcare of a 15-year-old? The patient, the 15-year-old, or a parent?
The parent.
The parent. Yeah. The usual situation is that a child, the parents make a decision. Well, you only need one parent to make the decision. Now, in practice, 16 and 17-year-olds are seen separately. So they are seen not as quite the same way as under 16s, and they are usually treated more like adults unless they want to say no to treatment which is in their best interests. Then parents can overrule them. But below 16, it's usually the parents who decide. However, this is where the issue of Gillick competence comes in. If someone under the age of 16 demonstrates to a doctor that they have sufficient maturity to make this decision themselves, a decision about whatever the decision is, then the right of the parent to make that decision, it's called lapses. In other words, they lose it. So if this child demonstrates to you as the clinician that they are mature enough to make the decision themselves, then they can do that. Okay. So there's a few things that come into this. So when you're faced with a question like this, the first thing is that, of course, having the mother present in the room is going to create certain specific issues. Not only is there a direct issue of there may be a confidentiality issue and the 15-year-old may not tell you the story, but also, of course, the presence of the parent may influence what happens and may inhibit the 15-year-old from what they say. And it may be very difficult for you to assess the 15-year-old's Gillick competence with her mother present, because you can't start talking about what's happened and assess her ability to deal with the issues if mother is present. So therefore, you certainly A and B are both out, because you can't ask a nurse to get the patient's consent, nor can you ask her consent directly with her mother present. So you have to see her on her own. Now then, you can't, so therefore that C isn't right either. You've got to see her on her own, and you cannot make any guarantee to the mother about what you will say. You may say nothing to her at all. At the end of the consultation, you may say, thank you very much. Is there anything you want to say? Because of course she can tell you things. You know, if she says, I'm worried that my daughter is being abused by an older man, then you can hear that from her, and that's important to hear that. But what you can't do is in generally speaking, unless the under 16 very clearly told you, I would like you to tell my mother, you cannot at the beginning guarantee that you will say anything to mother at all. You might be able to if you get consent, or if she's not Gillick competent, but you might not be able to. I hope that comes across. If she's not Gillick competent, you know, when you see her, she's clearly not got the maturity to deal with these issues, then you will need to have a parent involved. But if she, and then the mother will need to come in. But if she is Gillick competent, then she deals with the consultation with you, and you agree at the end what you do or do not say to mother. I hope that's clear. Now, the last option, speak to mother first. The problem with that is, I think that may affect the way the consultation proceeds if you ask the mother first, because the mother may influence the way that you tackle the problem, whereas you do need to talk to the young girl herself first and find out what her problem is and her concern. So for all these reasons, I'm going to say that D is the right answer. I hope I've given you some basis for that. The issue about Gillick competence in somebody who is under 16, do they have the maturity or not? The fact that to know if they're Gillick competent, you need to be able to speak to them on their own without anyone else being there to influence them. And the fact that if she is Gillick competent, her mother then has no rights any longer for any information unless you have that person's consent. I hope what I've said makes sense. Does anyone have any questions on that?
Yes, sir, I have a question.
Sure, please go. Please fire away.
To what age is the Gillick competency possible, like on the lower side? Hello?
Okay, so yeah, there's a good question. Let's unpack this a little bit. So, for example, could a 6-year-old be Gillick competent? The issue about Gillick competence is decision specific. It depends on the decision. So if it was a 15-year-old and you had a complex decision, something to do with going to the operating theatre and having a procedure done, they might have competence, they might not. On the other hand, if you had a 12-year-old who has a simple laceration on the forearm, which just needs cleaning, steri-strips and glue, a 12-year-old might be Gillick competent for that decision and therefore able to make a decision themselves. So it's age specific it's decision specific, depends on what the decision is. So some simple decisions, Gillick competence can go very early. There is no defined lower age limit. So in law, there isn't a lower age limit to Gillick competence. It began through decisions about the oral contraceptive pill. So that's where the name Gillick comes from a woman called Victoria Gillick, who wanted to enforce her own right to be present when her daughter saw her GP about oral contraceptive. And that led to this judgment by the very highest court in the country at the time, which said what I've just explained, that if the child has sufficient maturity, then the right of the parents to make decisions lapses, or even to understand, to know the details.
And sir, for children less than 16-year-old, how do we know that they are competent to give consent, or how do we know that they are competent?
Right, it's very similar to the capacity assessment. There isn't actually a defined way of doing it. It's left to the judgment of the doctor. So the college won't ask you this because it isn't defined. So it is a bit of a judgment thing. But, you know, if I say the capacity test, 4 questions, do you know those? So does the person understand the problem?
Yes,
Can
repeat
they
the
make information? Can they weigh it? Can they communicate a decision? So those are the capacity tests. I think with a Gillick competence, the emphasis will be on the first one. Do they understand it? And do they understand the implications of their decision, one way or another? So that would be the main emphasis. But there is no there's no legal definition of how you do a Gillick competence test. Okay, questions like that have come up in the exam, so don't be surprised if you get something like that.